Kia ora koutou katoa. Welcome everybody to this community research webinar on organisational outcomes and meaningful measures.
Thanks very much, Jan. It's a real pleasure to be here today with 400 people online. That's quite a big classroom, as you say. So yeah, here we go. So I'm going to be chatting a little bit about what I mean, first of all, by organisational outcomes. And then I'm going to get fairly practical and talk through some steps of how you might build one. So that's what we've got planned. So I just might show you the first slide. So actually the first slide is a cover slide. So and I was going to show you a picture of where I'm from and tell you a little bit about me. So actually I'll move on to that one. So the second slide. So there you can see a slide of Yorkshire. So I'm from the country in the north of England, but I actually live in Australia. So when I think about the country that I come from, we're very practical people from Yorkshire, and we're very straightforward. So I guess the lesson for this seminar is I'm likely to give you, be talking about things that are based in practice. The stuff that we are presenting, it's not based from books or from scholarly theory. It's actually based from doing this over 20 years. So it's very much grounded in real organisations and what they've tried to do and what they've failed to do. And I hope I'll be able to bring you some secrets from that. So the art of being practical, that's what I bring from Yorkshire. And I guess one more thing to say about me, just so you understand my perspective, is that I'm an evaluator. So I have a PhD in evaluation. So I do tend to come from this a little bit from how would you measure it? But I guess over the years, that's where I began my journey, sort of thinking of how you measure things. But what I've learned is it's getting a good organisational framework in place with clear outcomes is far more than just for measurement, because of course it goes to the heart of strategy and having a really clear direction for all of you and understanding how all your work fits together. So if you're only doing this for measurement, you might be pleasantly surprised that it has many other positive outcomes. So yeah, so let's get stuck in, and I'll move on to the next slide, which slide number 3. And I'll talk a little bit about what I mean by organisational outcomes. But you might note the photo there on the slide. You'll see lots of people actually building models. We often do this interactively, hands-on, writing things on bits of paper, posting them up, arguing with each other. So that's a little bit of how we build it, and we'll come to that more. But let's go to the next slide now. So the next slide is some definitions. So what do I mean by organisational outcomes? Well, I guess ultimately it's a set of outcome statements, a set of descriptions. But the really important thing to note is that what we're talking about is the what and not the how. Now, this sounds simple, but it's the heart of it all. So what do I mean by that? I mean, if you go on a train and you go somewhere, you go on a journey and you see lots of places along the way, that's the journey. But where do you get off? Where do you hope to get off that train? And that's what we're talking about. So an outcome statement describes the destination that you want to get to. And it's not actually about the journey. And I know journeys are really, really important, and we need to be really clear about what our journey is and how to get there. But the outcome statement needs to get to the what. It needs to separate the how from the what. So that's the most important thing, is to get your what really clear. And we sort of write these down in statements, and we do it together. And together, these statements should depict what your organisation is collectively trying to do. And that sounds quite simple, but it's a political process, because it cannot include everything. That's the really important thing to understand, is your framework won't include all the work you do. So what are you going to include? What are you not going to include? So while it's just some words on bits of paper, it's important that you agree to it and that you elevate the most important aspects of what you do and what you're trying to achieve. So it's a diagram. Mostly it's shown as a diagram. And it can be a simple diagram, or it can be a really complicated diagram. And I've learned over time that different organisations have different appetites for complexity. So I'm cool with some organisations wanting a simple diagram and other organisations wanting a really complex one. I work in the environmental space a fair bit, and they are scientists, and they have the most complex ones you've ever seen, really, really detailed, and that's the way they like it, and I'm cool with that. And other organisations, they want the 9-box model, and that's as much as they want, and they want simple language. That's fine too. So let's remember that there is no one size fits all, and that you need to work out what your appetite is and make it work for you. Let's go to the next slide. Let's have a look at, we've been talking in the abstract, but actually, you know, this is ultimately very visual stuff. So I've got a simple model here. This is from an education program, and I just want to talk you through a few different things here. So this is a 1, 2, 3, 4, 5, 6, 7, 9 boxes. So you've got a goal at the top, yeah? All young people reach their education potential. You'll notice the language. There's a convention that we have of keeping the language as simple as we can. So we use active voice, and we try and name who it is we're talking about at the beginning of the statement. So you could say learning outcomes achieved, but that's written in an abstract manner. So instead, if you say all young people reach their educational potential, that's more active. So that's one of the things we try and do. We try and keep the language really active and name the person that we're trying to see a change in. And that really helps later on. So that's the goal. However, in this particular organisation, this is actually from Vanuatu. A lot of my examples are from international settings, but this was for the education program the education partnership in Vanuatu. And that was the goal that they wanted to ultimately achieve, but they focused their efforts on 3 things which they had determined were the key, if you like, the key areas where there were constraints, where there were problems in not getting to these outcomes. So the first thing was that all girls and boys, including those with disabilities, are able to access early years schooling. So that's about being able to get to school. And then more children enroll, that's starting school, and then when they're there that they stay, children stay. So they're the goals. But it still doesn't tell you really exactly what strategies, what ways we're going to influence these outcomes. So the green boxes below take it a level lower. And here they say, okay, we need to see communities valuing education and demanding quality more. We need children with special needs in particular to be able to access, and we need the cost of schooling not to restrict attendance, because in Vanuatu they have to pay school fees. And the school facilities and equipment need to be adequate and secure, and there need to be enough of the schools in the right places. So that's an organisational outcome model. Now, what I want you to know about this diagram is none of those boxes are about what we're doing. Yeah, none of them are about the how. Can we just flash back to it again for a second, David? So you see, there's not even the lower level, this green level, it's not about what we are doing, is it? It doesn't say we are subsidising school fees, we are working with community. So it's not actually really about what we're doing, it's about what we're trying to achieve. So this is the key to outcomes, is to get to the what and let go of the how for a while. So this is an example of an outcomes framework. This is stuff that we really encourage people to try to do, to try to get to the what, to draw it up in simple language and to get agreement on it. And you'll note there's 3 layers here, and that's quite common to look at the layers. And when I talk a little later about indicators, it's quite important that we think about which level of change we're going to measure at. Okay, well, that was just a simple framework. I want to show you a more complicated one, because there are lots of different ways of diagramming this. So we might just go to the next one. The next slide. Now, I'm not going to go through this. I just wanted to show you that it's not linear. I'm not going to walk you through this diagram. It's too complex for the webinar. But I want you to see that there are arrows going in lots of directions, and it's not linear. And it's more of a systems model. So it's okay to do your organisational framework more like that if that suits the way you work. So you can go from left to right. You can go up and down. You can go round and round. in circles, if you like. There is no right. It's about you getting down and agreeing on what it is that you're trying to achieve. Yeah, so we'll go to the next slide. So I guess I'd like to sort of point out why we do this. So what's it all about? And I guess there's a dream here lurking around. I don't know how, it's a very ambitious dream, but there's three aspects that we get excited about, I think, and we hope for when we do an organisational framework. First of all is that if you do it well, the idea is that you'll get a framework that actually helps you to be more strategic and get to outcomes. So by thinking through what is it that you really are trying to achieve, what are the outcomes that you're really getting behind? And then you think about, well, what needs to be in place to get those outcomes? And then what is the best strategy to achieve that? You are more likely to achieve them, right? So this is a big dream. It means, you know, improved health outcomes for your community. It means less children living in poverty. It means better environmental outcomes, yeah? And so these frameworks can actually help you hit your outcomes. So I guess that's a massive promise. That's the first one that we can get excited about. The second one is the dream of having a simple diagram that shows the outcomes that your organisation is trying to achieve in a way that all your staff, or even whoever's working on it, the community, can see where they fit into that story. I've got to tell you a funny little story at this point. Once I was working in Papua New Guinea, and I was running a workshop and developing outcomes, and we had these levels of outcomes. And this man said to me, and you got to bear with the story here for a minute. He said to me, "You have made me a better man." I thought, this, what? How? What have I done? And he said that he'd been working on this program, and it was a program to reduce. It was an HIV prevention program, so it was about HIV, and his sister had died of AIDS, and he joined the program to fight HIV. And but they kept telling him that he had to build capacity of people, and he was saying, I didn't come here to build people's capacity to do this thing and that thing. I came here to actually address HIV, and I can't see how my work is doing that. And when we built the model, he went, oh, I now understand that I'm doing that leads to that leads to this, and it leads to less HIV, and that is why I'm here. And he was so happy. And he felt like finally he understood how his work fitted in with the bigger picture. And I think that a really good theory of change should help all your people see how their work fits with the outcomes that they care about. So this idea of a collective and shared vision to see where your work fits in is a really important one for a group of people. Finally, the third one, which evaluators like me get excited about, is that the framework can help you tell your story to others of what you're trying to achieve and how far you've got. And it also can help you measure your impact. Now, this is the sort of technical part of outcomes measurement framework, and I'll go into more depth in the third session on how it does this. But at the moment, if I just say, you know, a definition of story, and I know you guys in New Zealand are very into story. Did I tell you I was in Australia? I'm not actually in New Zealand, just in case you don't know. Story is defined by its structure, the beginning, a middle, and an end. But structure, it has a structure, yeah? So if you have an outcomes framework, you have a structure to tell your story. So you can have a structure of what you're doing, how far you've got, and what you're trying to achieve. And if your outcomes framework is clear, then you can use that to help you tell your story. So it's great for that too. So that's the dream. It's a lot, and actually it's hard to get one that does all of that. But that's when it works really well. That's what it can give you. Okay, so let's go to the next slide. So what I've heard people say is, "Oh, haven't we already done that?" I've heard this one quite a lot. They say we've already got a strategic plan. We've got a strategy. We've got our mission. We've got our vision. and we know what our values are. So why do we need to do this? Yeah, we've already got one. And that's true. You probably have done quite a lot of work. Maybe you've done a lot of work to get this right. And that really does help to get your outcomes framework. But sometimes a strategy is written in a way that doesn't actually make the outcomes that clear. Where are outcomes? Let's just go to the next slide for a second. David, if you could go forward. So you see this, I got this from the internet. It's a clip art, strategic planning. And here you go. So this is sort of fairly standard set of things. A vision statement, yeah, you recognize this. A mission statement, the strategic drivers, the critical issues. Where are the outcomes in this? So they're not necessarily clarified through a strategic planning process. The theory of change is not necessarily clear from this. So there is another step, and I am a real believer these days in the importance of thinking through how you believe change actually happens, thinking through the actual change process. How will you improve the nutrition of the people in your community? What is stopping them from having a good nutrition now? What's going on? What is the overall change process that's happening, and how can we influence that? And that's a sort of another piece of work. It's not the same as a strategic plan. And it depends how you do your strategic plan. In sort of modern approaches to strategic planning, some people do this anyway, and maybe you already have. But for a lot of people, they sort of bypass the outcomes or don't pay enough attention to them. So it may be that you've done a lot of work on your strategic plan and you may not have a clear outcomes framework. It took me a long time to work out that they're not the same thing and that they're a bit different, and they come together sometimes, but not always. Yeah. So, so let's talk about, given that, let's talk about briefly how you actually go about building an outcomes framework. So let's go to the next slide. So I've got 4 steps for you here, 4 simple steps. Look, I am absolutely obsessed with scoping because I work as a consultant. I walk into lots of different organisations. Yeah, that's the joy of being a consultant. You get to see what a lot of people are doing, and what I note is that they're all different. Yeah, they all need different things. There isn't a recipe that you can follow that gives you exactly the right framework for you. You have to work out what you want and why, and that will lead you to an individual journey to develop this. And it starts by scoping. It starts by working out what you actually need and want, what your appetite is for complexity, what you're going to use the information for. So it's really important is scope. And the next step is to think about your journey and the co-design and who you will involve in actually developing your framework. Because if you remember that story about that man in PNG and how apparently I made him a better man, he had to be there. He had to be in that workshop, you know. And so it's like, how do you engage people, and at what points do you engage people? And then, so when you've thought through your engagement journey, then you can do it. You can get out there and you can start mapping your outcomes with the people you've decided to do it with. And that might take a few steps because this is organisational level. So it's a little bit more tricky than a program level. So there's lots of choices to be made. We'll have a look at the choices that you make. And then when you've got your outcomes clear, it's only then that we start to talk about indicators and measurement and targets. So they're the steps that I'm going to talk you through today. I'm just going to, in this session, I'm just going to briefly talk about scope, and then we're going to stop for a pause. So I'll just go on to the next slide and just share a few secrets about scope. Okay, so how am I going on time, Jan? 22. So this is a little longer, but we'll keep going. Next slide, please.
Yeah, so we are running it behind a little, Jess.
Okay, I'm talking about too many stories. Okay, so
talking about your life-changing skills too much.
I know, yeah. So why have one? Okay, so you need to think through what you're going to use it for, what decisions it will inform. Is somebody demanding one? Is somebody telling you you've got to do it? What do they want for you? Or is it just for you? It's always easier if it's just for you, but if it is for others, you better work out what they are after. And do you have support of your own highly, the execs in your own organisation? Are they behind it? What do they want? Does it have to report to the board? It's very important to be clear about what you're going to use it for. Next slide, please. So what should it include? A secret, an early secret that I'm sharing with you now is that good ones are tailored. As I've said before, they come in many different shapes and sizes. Now, I just want to alert you to these 5 domains, okay? Now, you don't need them all, so I don't want you to panic and say we all need all of them, because you don't. It's just laying the groundwork. So that obviously the one that you should include is the first one. So that's the about your outcomes or your impact. And in a sense, this is the question is, are we achieving our ambitions? Are we achieving what we set out to do? And that's nearly always there. But the others are sneaky, because they sneak in sometimes when you don't realize that you actually need them. So it's worth checking that any of these are present. The second one is, it's not so much are we achieving our ambitions, but are our ambitions even the right ones? Are we doing the right things? Are we shooting in the right direction? I call that remit, and it does crop up a lot at the organisational level. And the simplest framework I see a lot is impact and remit, the first 2. So that's a very common one. But then there are a few more here. So another one is enabling. Is our organisation providing the right enablers for success? So that might be your internal stuff, your leadership, your talent management, your systems. You can have outcomes about that. So sometimes the outcomes are inward facing. Now that can trip you up if you haven't worked that out. Now there's another sort of, sometimes people put them together. I call them business effectiveness. And sometimes, especially for a little NGO who's struggling to stay alive, you've got to think, are you operating in a sustainable manner? Are you balancing the budget? Are you managing the risk? Are you managing your reputation? And this is sort of a bit like being business savvy, and for a little organisation that's operating on a thread, this can be quite important stuff. The final one is process. Are we doing things? Are we doing things well? And that one shouldn't really be in here because it's not an outcomes framework, but you better talk about it, because sometimes if you don't, it can come back to bite you. People can ask about that one. And if you want to include it, it's outcomes plus, but it's certainly an option you have. Okay, we might go to the next slide. So that was the simplest one. So I was talking about, if you really want to keep the scope simple, impact and remit is a very basic one. Okay, and I think that's pretty much done on scope. So I was just wondering whether you wanted to say a few things, Jan, about your experience with having a go at mapping outcomes. Yep, over to you.
Thanks, Jess. I have to say I'm experiencing a particular sense of exposure and discomfort now that I'm going to show my theory of change to Jess Dart, to Dr. Jess Dart, none less. We're going to have there'll be a short pause now whilst I share my screen, because I'm going to show you the theory of change which community research produced. I'll just check that people can see that. Can you give me a thumbs up, David? Cool. Here's our theory of change. And what I'm going to do is back present and show you how we arrived at it. Those of you who know the whakapapa of community research will know that when we formed in 2008 under our governance group, the first thing we produced was a document called our Strategies in Action. We then went on to build more program in our work. We started with building the community research website. Further down the line, the Maori caucus of our board developed the Whānau Ora research website. And more recently, we've developed What Works, which is a website and a program of work which supports that. At the point that I came to, or that we came to design the theory of change, we wanted to incorporate all of that thinking into one place. So as Jess has described, there was actually a lot of thinking around the scoping of this. In order to produce this theory of change, I think we went through about 8 iterations of this. And I worked very closely with one active and involved board member, and we toed and froed. This document had so many different distillations. I'll just use my cursor now, and you will see that All of the projects I've just shown you, the community research directories, the whānau ora directory, over here, the What Works portal and the webinars, have been condensed now into our theory of change. And if we go up to our intermediate outcomes, let's have a look at what we say we want to have achieved as intermediate outcomes. These are taken from the original document that I showed you, our strategies in action. So we said that we wanted to be more connected. We wanted to connect up research, that we wanted research to be visible. And these are all taken from that document. And going up to the top, we're looking for putting in place supports to make for a more healthy and engaged tangata whenua community and voluntary sector in Aotearoa, New Zealand, so that we're all more prosperous, engaged and inclusive. On a practical level, everybody who's watching this event is going to receive an evaluation form directly after this event, and you will see that we ask you questions which ask how effective we've been in terms of these contributions here. So, Jess, I was saying to you that the actual process of developing this theory of change probably took us maybe 3 or 4 days. It was actually midnights, just working late to turn this around and to pass it between people. But the thing that has taken time has been now to align all of our data that we're gathering, either from Google Analytics or through our funders or through our feedback from our webinar attendance, so that we're only gathering data that's relevant to this theory of change, and we're not gathering data that we don't need. So I'm going to show you just quickly how I drew this up. In those days, there was no What Works website. So it was really just me as a single part-time worker trying to work out how did I devise this. And I tried, another thing that was time-consuming was I tried a number of different sites, but I eventually landed on this one. Let me just see if I can show to you. So the theoryofchange.org is a website. I hope I have the right one here. It's a website which steps you through the process of developing your own theory of change. So here we go. What's the theory of change? How does it work? And these people really stepped me through it. Lasse, if we could put this link onto the What Works website, that would be really helpful, because I actually found, as somebody who couldn't afford to attend a 5-day workshop with Jess Dart, and we couldn't afford to bring an evaluator in to work with us, this was a really good place for self-directed learning. I tried a number of other sites. Jess, I was saying to you, I'm just going to stop sharing now, if that's okay, so I can sort of come back. Jess, I was saying that one of the things that made this difficult was working out what was the most useful platform for us and sort of having to do the homework myself. And I developed a PDF on that Theory of Change website, and then it got sort of stuck with a bug in their system and I couldn't download it. I later went on to Paul Dignan's DoView, but I found that a little too complex to work out for myself how to work it in a sort of self-directed way. And in the end, you know, we just ended up with a plain Microsoft Word document, and we just kept it nice and simple. It's a little bit volatile, those boxes jump around, but we found that we didn't need a fancy software in the end. One of the unintended outcomes of that has been people look at the theory of change and they say, oh, now I get it, I see what you do. You know, sometimes they find it's quite a difficult organization to understand, and having things in one page has it's been a very useful document that served more purposes than I'd originally intended. Maybe that's enough for now. Just to have shared a practical example from our sector, from a small organization that had to do it for themselves.
Thanks so much for sharing your example, Jan. It's great, because I love your honesty about talking about how you lost your PDF and things like that, and what you went through, because it's quite common. And I would it's a good tip for people: don't over engineer it. You know, at Clear Horizon, we do theory of change modeling as a core business. We've got 25 consultants who are doing it every week, all the time, and we've been through every sort of software. And you know what we use now? We use PowerPoint, because everybody's got it. It's the drawing tools have got better over time, and once you're happy with it, PDF it, you know, and then you can. One of the things is that we like to change them quite a lot. People like to change their theory of change as they learn more, and so you need to be able to change it. So some of the software options are not as shareable or as easy to change. So I think that's great. But that website is the best one, I think, the theoryofchange.org. So I think that's a great hint. Okay, so should we go into the next session? So the next session
Yeah, and I'll just remind people as well that there will be opportunities to ask Jess questions later. And Lassa, our chat host, is there in the background taking your questions. So we will get a chance to put some questions to Jess later. But she says, actually, the hardest bit is yet to come, so pay attention. We're getting on to indicators later. Okay, thanks, Jess.
Okay. All right. So the second part of this seminar is to talk, and I'll be a bit briefer this time, I promise, Jem. We're going to talk about the journey of building a theory of change, and Jan sort of started us off with an example there. So a little bit about the journey of co-design, a bit about the actual mapping process as well. So let's go to the slide 17, I think. Yeah. Oh, no. Okay, we're on that one. That's fine. So there's steps. So we're on the second part. So let's assume we've scoped it. We've worked out what sort of theory of change we want, and what's going to be included, what's not included, and why we want one. And then we can start thinking about how we might build it. I really do encourage you to do this in a deliberate manner. So let's go to the next slide, and that's just a title slide. Yeah. So we're going to do the journey and co-design. And next slide, please. So challenge. I just want to alert you to some challenges here. So I don't know, I'm sure you might have done theory of change for a program or a project before, or maybe you haven't. But when you do it at the organisational level, in my view, it's a little bit more political. So it's something to watch out for. So three scenarios to share with you. One is that I've seen a lot is that somebody in an organisation develops a model on their own, and they do it and they're quite pleased with it, and then nobody looks at it. Nobody uses it because it's just theirs, isn't it? So diagrams, they look big and scary and they just don't do it for everybody. But when you've been part of making it, then it's your mess. So we have to share the diagram together, and the diagrams are not really a great external communication thing. Maybe like for me, I can look at somebody's theory of change now and get excited by it. But mostly when you look at somebody else's, you go, well, a big diagram with arrows. So, but when you've made it, when you've fought it out for that little word, and it's a different story. So the first thing is you really have to do it together. Whoever your organisation is, whoever your people are, you need to do it together. That is a totally different thing. So sooner or later, you need to think about that. So that's the first one. If you don't engage anybody, likely they'll never look at it. That's the first problem. Second problem is when you do it together, there's politics, because you can't include everything. This is a particular challenge for an organisational level. Now, Jan's, yours is lovely and simple because you're a small organisation. The bigger it gets, the more this is challenging. I've been developing an outcomes framework for a program that's $300 million a year, and it has 35 very, very different things that it does. And not everything is going to make it into the diagram. Not all the outcomes are there. And so if you're going to make decisions about what's in and what's out, you need to do that. You need to really think about the politics of that. And the other thing that sort of goes on with that is that if you get a really good outcomes model, it often affects the organisation afterwards. Sometimes teams are reformed around the outcomes. People are given responsibility for the achievement of those outcomes, and it changes the structure. And things that are not there maybe get de-emphasised over time. So even though it's only a piece of paper, it actually has a bit of life and it has a bit of power. So you need to be aware of that. So I guess that's why engagement's so important. You might go to the next slide. So co-design. So I'm using the trendy term co-design. What I really mean is taking people with you. And there's also different ways of doing this. And it really depends on your organisation and how you relate to your community and who your community are. So there isn't a right way of doing this, but what I would suggest you do is think about how you're going to build your organisational outcome and your indicators. Map it out, and I've got one. I'll show you an example shortly. But then look at see every point in the journey as an opportunity to engage people, and think about whether that's a good opportunity or not. And sometimes it's better for a few people to do it and then share it with others. So you've got to think it through and be deliberate about it. And I like to have a little engagement plan around even just a one-pager saying who we're going to engage with at what point and why we're doing that. I think it's really good practice. I guess the key to good engagement, and we'll hear from Crystal later about her experience, but it's really important not to engage people and then not listen to them, not to raise expectations, say, what do you all think? And now I'm going to ignore you, you know? So if the executives are going to decide that bit, then don't engage. If you're going to bring people in, then you have to be clear that you're going to consider what they have said, or maybe even hand it over to them, but you need to be clear about where the engagement's going and what your promise to them is. And that's how we build trust and engagement. And I like to be really deliberate, especially when I work at the organisational level. You know, people whole sections have stopped existing. I've seen happen when a new direction has happened. So it's really important to be clear about the power of this stuff. I wanted to show you an example of one that I've been doing. It's quite a big one, but it gives you a sense of the scale of this stuff. Could we go to the next slide, please, David? Actually, the next slide. I wanted to show you the diagram. I hope you can see that. I'll talk you through it anyway. So in this case, this is an example of the one that I was doing for a program in Indonesia, an organisational one. So we started out with a few people to scope it out, not everybody, just mainly the executives, and we sat down and worked out what we wanted included, what we didn't, how many outcomes we wanted, how comprehensive it would be, what the time frame was, what the domains would be, and I wrote a little 2-page concept paper based on that discussion, and then we shared that and people gave us feedback. So it was a way of getting broader feedback just from a paper. The next step, so we had our concept and we had a sort of shape and the style of the framework. The next step was to go, okay, well, let's have a look at all our programs, because there were 35 programs that we had to consider. So we looked at all of their outcomes and the theory of change, and we looked across them. And I actually sat down and just put a really rough thing together to start them off because it was so complex. And then we had a workshop where we thrashed it out. And so the prototype that I put together looked nothing like it at the end. It was just a place to start. And we had a workshop with, say, 35 people in, and it was a big facilitated event, and everybody got to say their point. And we nutted out a framework. But you see, to get to that point, there'd been 2 steps already. We'd scoped it, we'd looked across all the programs and brought it together, and then we agreed. Do you see what I mean? So there's these different opportunities for engagement. And then we needed some technical support. So we had another workshop which was a bit more technical to think about the indicators. So not everybody went to that. Not everybody had that know-how, really. So that was a different reason to engage. But we developed a draft of some indicators. And then we went around and did lots of small meetings with everybody to check to see whether they could collect those indicators and what the problems were. And we developed a second measurement framework. And then the next step, I can't see it on my slide, was to actually collect the data and bring it all together, aggregate it, and the results. But this was a big program with lots of moving parts and 35 different programs, 500 million. I just wanted to show you that there's a process of engagement that you can use. So can I go back to the previous slide? Sorry, I'm going backwards now. So you've got all these opportunities.
Need to speed up your presentation a little, Jess, just so that we don't run over, okay? Okay,
yeah. So you've got some choices for how you engage. You can develop the principles first. You can engage executives or not. You can develop a rough model and share that, or you can just go cold turkey and everybody in all together. So that's it. They're the strategies. Okay, we'll move on now. The only other thing I was going to say is a resource for you. So if we could move on to slide 21, the next slide. This is back one. That's it. This is the IAP2 spectrum. I won't go through it, but you can follow it up on a link. You can look at IAP2. It's the International Association for Public Participation, and they It helps you think through what you're promising at different levels, from inform all the way through to empower. And I love using this to classify and think through how I want to engage people at different points. Okay, so let's move on to the next step. So the next slide, please. So mapping your outcomes. And I'll try and be brief. I'm obviously getting into talking too much here. So let's go to the next one, mapping your outcomes. Some basic rules for actually, if you get to the work, when we actually get into a workshop, I guess I'm talking about now. So we'll move on to the next slide. So some really basic rules here is make sure you do actually have outcome statements. Back to that very first thing I said, we want mapped out the what, not the how, the destination, not the journey. So you have, for example, one of my favourite outcomes was flourishing biodiversity, rather than we will work to make biodiversity flourish. So ideally, you get to the end point. Don't get lost in battles around semantics. It happens in some workshops. I have a great little tip for you. If you can't agree on the wording, underline it and say, we'll deal with the wording later. Just let's agree on the intent. Keep the language clear and active. As I've said already, 10 words per outcomes. Try and name the actor. I don't put targets or activities in the early drafts. Keep them out. Keep it simple. Yep. Okay, next slide. I guess there's another challenge for you, and maybe the biggest challenge of all, which is particular to organisational outcomes, is how you represent the whole. And you have to balance complexity with simplification. You've got to have challenges on how to cut the cake. There are choices, and you have to take people with you in this journey. So on to the next slide. Next slide, yeah. This is my Rubik's Cube. So I just want to give you an idea that, like a Rubik's Cube, I'm not talking about twisting it, I'm talking about turning it so different sides face out. So at this point, the slide that faces out is the levels of the organisation, the whole of the organisation, the programme or the project. But over the top, you've got child protection, disability, ageing and caring, which is themes. And up the sides, you've got these remit, process, results, outcomes. Now, people tilt different ones forward. So this gets complex. It's probably easiest if I show you in a diagram what I'm talking about. So I might move forward one. Actually, it's forward two. I'll cut that slide out. Now, I know this is a complex theory of change, but this is what a lot of organisational ones look like. I've been given permission to share this. This is from the Australian Centre for Social Innovation. So they do a lot of work on social innovation. So they've got if I show you the balloons, this sausage here is about creating solutions and innovating. And this is about building the capacity of organisations to innovate themselves. And this is systems change. So they've structured their model based on the sort of on the type of services that they provide, but also at the levels of systems. Does that make sense? So at the top here, they've got their thematic areas of disability, health. So they could have chosen to have this sausage on health, this sausage on disability, and this sausage on something else. But instead, they chose to structure their model by the type of service that they do. So there are choices in how you present your model. You can present it, go back one now, go back to the previous slide. David? Yeah. So you can present it by the content area of the theory of change you can just go with the grain and map out your existing organisational units if you like. It's easier politically, but you might not really be that strategic if you do that. You can map them, you can choose to map them by user group or level of the system, but there are choices to make. There's more than one way of doing one. That's what you need to basically take from this session. Okay, so let me see where I'm up to. That's probably enough. I'm going to stop at this point and hand over.
Kia ora, Jess. And before we hand over to Crystal Kekepo, who's going to speak from her own experience, I've had a couple of questions come in, Jess. So Cam Brinsden is asking, do you use the outcomes framework, or can a person use the outcomes framework to actually allocate budgets? So once you have your outcomes set, then you prioritize the outcome, and then what would follow would be then you decide how much is worth spending on what. Do you want to speak?
I've done it. We've done it as percentages, actually, not so much budget, but like what percentage of our effort or our budget is going into each outcome, like 80, 80, 20. That's the way we sort of start with it. Yeah. So it is possible to allocate budget to it. We normally start with percentages of the total budget. Yeah. Yeah, that's a great way of doing it because it's outcome-based budgeting, basically. Yeah, it's good stuff.
Thanks, Jess, for that. And we can continue the discussion with Jess on the Facebook page later. But now it's a very great pleasure to be able to introduce to you Crystal Kekepo, who's from Cook Islands descent and also Ngāti Kahungunu. Crystal jumped out at me the first time I heard her speak, not least because she describes herself as somebody who's just graduating from Te Wānanga o Raukawa as a community research and co-design specialist. How great is that to know that people are describing themselves in that way as graduates? And Crystal, also, her work appeals to me because she does know about co-design and because she's working in areas that are with people and they are to do with intangible areas as well. So we thought in order to give you a rounded webinar, we would invite Crystal to talk just briefly about her mahi and her co-design approach with her communities in order to map outcomes. So kaya koe te rākau, Crystal.
Hei aku nui, hei aku rahi a tēnā tātou. Ko kahurana ki te maunga, ko tuki tuki te awa, ko takitumu te waka, ko Ngāti Ngaringari te hapū, ko haungaria te marae, ko Ngāti Kahungunu te iwi. Whakawhiti atu ki te moana nui a kiwai te taha o tōku pāpa no mangaia ia. Ko rangi mōtia te maunga, ko awarua te awa, ko rangi mātoru te waka, ko maruata te marae, ko Ngāti Wara te iwi. Ko karanga nei te reo o tōku tupuna ko ngāwi I tino kura Pekepo, tangi ke rawa. E tika ana me mihi ki te rōpū kai rangahau hāpori ki a koe Jan. I tēnei kaupapa I whakarite, kōrua ko Jess, I whakarangatira ana I tēnei huihuinga, tēnei whakāturanga me ki. Ko Waiau, ko Crystal Kekepo tōku ingoa, ko au te kaimahi o te tōpūtanga o Toi Tangata, ko tōku mahi he kairangahau hāpori, me tētahi atu hoki ko te mahi awaha. So my name is Crystal and I work for an organisation called Toi Tangata and I specialise in community research and co-design. Toi Tangata are specialists in nutrition and physical activity. Our obligation is to positively contribute to continuation of whakapapa, genealogy, using Matauranga knowledge and whakapapa approaches to physical activity and nutrition. Toi Tangata means the art of human potential, and our role is to communicate mana-enhancing messages and methodologies to empower whānau to understand, achieve and excel in their own physical health and well-being. So I'm just going to briefly talk to you all about my role in co-design and one of the models that, that I used in the space. So if we could just go to the first slide, please. So in the co-design space with Toi Tangata, we worked alongside in a project called the Healthier Lives Challenge with Nihi, Auckland University, Massey and Otago University researchers to work alongside Māori and Pacific communities to create an intervention tool to reduce the risks of non-communicable diseases such as cardiovascular and diabetes. My role in co-design basically was to create something where we were able to gain more insights as to how community think, feel and see well-being. And so if you can just move to the next slide. So what we wanted to achieve basically is, one, we wanted our community to have their own rangatiratanga, their self-autonomy in creating this intervention tool. In this space, we didn't know what that was going to look like. And we used what we call the te hekenga model, which is a metaphoric model used to navigate whānau wellbeing. And as you can see here, you've got Hawaiki, hekenga, and Aotearoa. So the model with Hawaiki is using historic kōrero, and Hawaiki being the idea of why our people migrated. Common contributing factors were famine, warfare, overpopulation. And so using that model in our contemporary setting or our modern world is having whānau understand, okay, you know, what are some of the things that you wish to improve in your well-being, and what would that start of your journey kind of look like. Te hekenga is the journey, so our people traverse the great oceans of Kiwa, or the Pacific Ocean, aboard Waka Haurua. They brought a lot of Matauranga and a lot of kai and valuables with them. So hekenga in our contemporary setting is the idea of what barriers may you face on the journey that you wish to pursue in your well-being. What are the values that you will take with you on this journey? And what are the resources that you would need to pursue your well-being or your koiora? And Aotearoa being the tukunga iho, the outcome that they wish to achieve. So through this wānanga space, using this model, the outcomes that we were centred around maintaining a strong connection with whānau and to place, or tūranga waiwai, which is our tūranga waiwai and marae is a belonging through kinship and whakapapa to land, to whenua, or to your geographical location in which you were brought up in. Your whānau connections, communication, enjoyment and fun, cultural identity, and whānau engagement rather than that of an individual. So those were some of the common themes that derived from these sessions, and barriers such as time and socio-economic factors such as finance were common themes that derived from using this model. So this model was used to create a culturally tailored intervention tool to reduce the risks of non-communicable diseases, and obviously, you know, some of the outcomes that were in this that came out of this wānanga weren't necessarily based around physical activity or nutrition, but these were more deeper insights as to how the community are thinking about well-being. Keeping in mind, using co-design, is having that understanding that our community are the experts in their domain. We are merely there just to facilitate that process. I guess using a metaphorical model or Matauranga Maori whakapapa approaches is an insight to how we conceptualise well-being, how reo, tikanga, Matauranga and whakapapa help articulate that concept within its simplistic form. So, yeah. Kia ora.
Thanks so much for that. That's a fascinating story of using metaphor. That's incredible. I haven't heard anybody do that before. And lacing in the cultural, I'm not from New Zealand, so please forgive me. Lacing in the cultural element to co-design is really powerful, isn't it? So, yeah, I'd be interested to know how you narrowed down on what you would focus on, because that sounds like quite a lot of things that came up, a lot of ways of engaging. And I guess, I don't know how big your organisation is, but I'm imagining that you might have had to narrow down and sort of prioritise some of the things that you would do. Could you just talk to us about that?
Yeah, so the common outcomes that I explained were basically themed through a thematic analysis. And it wasn't easy, you know, it's never easy to chuck everything all in the one basket. But by using those common themes, we have actually been able to create, well, the community have actually created this intervention tool, which we've called Order, and they've used all those concepts through physical activity and nutrition. So in this app, so when we talk about whānau engagement rather than that of individual, whānau had the idea of creating challenges in the app, and it was also that opportunity to invite whānau that don't live locally, so using technology to interact and engage with family who may not even live in the country, to participate in whānau challenges, whether that be drinking 8 glasses of water, and how, you know, and getting rewards for all those different challenges, or if we look in the nutrition space, whether that be sharing recipes and challenges on healthier eating. So that's just one of the many conversations or communications that came from our community, one outcome in this app.
Wow. Okay. It's not. It's really interesting to hear how you're combining it with technology and going all the way to the app. That's a really interesting. Yeah, I'm actually going to focus on one aspect mainly, and that's a common challenge of developing indicators. I'll just focus in on one thing, seeing as we're a bit short of time, but I think this is really one of the most important things. And that is pitch, where to pitch. You've got this outcomes model, right? Do you cover it in indicators? Where do you put them? Yeah. So how do you actually choose where to pitch your indicators? And the challenge is people often do them too high or too low. So too high, you put them really high up in the goal level, and it's the stuff that you care about. Yeah. So it might be about the ultimate health outcomes of your example, Crystal. It might be about nutrition. It might be the ultimate nutrition, but you might not see changes at that level for several years. So if you've only focused at that level, and you may not see any change, there may be other things influencing it other than you. And you could feel like you've failed if you only focus at that level. The other trap is going too low. So it's focusing on outputs. So you basically focus on how busy you've been, how many workshops you ran, how many people came, how many apps you produced, how many people looked at the app. Useful, but it really is only saying we've been busy. So the challenge that you can fall into is that you end up with an indicator framework that tells you we've been really busy, we'll tell you what we've achieved in 20 years, and it's not going to work, right? So we need to change the way we're thinking about pitching indicators. So let's go to the next slide, and this is the last slide that I'll present. Can we turn next slide? Oh, the next one. We want the diagram. That one. I'm just going to talk to this slide and then I'll stop. I think this is the most important thing. So I think this is a really useful slide to think about what you control and what you influence. So here's our sphere of control. What do we as an organisation really control after all? So often this is just our activities and our outputs, the things that we can show that we absolutely did it. How many people, sometimes you could include participation here. How many workshops we ran, how many websites, how many things we put up, maybe a little bit about who hits. And then there's this big level up here, top level, is our sphere of interest. We might be interested in poverty reduction, population level outcomes, well-being, environmental benefit, right up here. This is what we're passionate about. It's where we want to see change. But we might be a little organisation working in coalitions with many others, and the people that we're trying to influence have other things influencing their lives. You take nutrition, you take how long you live, for example. There'll be genetic factors that influence that. There'll be all sorts of things. So what we have to try and find is what's our sphere of influence in the time that we dictate. So if we say, what are we going to achieve in the next 2 years, right? somewhere here is the golden bit of measurement that will show us whether we are on track to achieving this stuff up here that we care about. And it's higher than our output. It is your theory of change. It is your organizational framework, which will help you identify this stuff here. And it's the in-between measures or the intermediate outcomes that are the gold for this stuff. They are the things that are more than being busy, that the areas that you're focusing on. And if you are not showing change here, if this is not happening, you have time to change your strategy, adjust your approach, learn and try something different. If you only measure up here at the population level, you may never see any change. You may not be able to show the attribution of what you've done to it, and you're left holding nothing. So what you need to do is pitch some indicators in this level here. And so that's it sounds a bit esoteric, but that's where I'm going to end because time's up. And I just want to thank you for listening in, and I wish you luck on your journey in measurement, and I'm here to answer questions.
Cool. Thank you, Jess. And I'll invite people to put their questions to Jess or to Crystal. But in the meantime, Jess, I know you said this was one of the most important points that you wanted to make. Could you give us a practical example of, you said that the intermediate outcomes are the ones to watch and they're the ones that could be adjusted. Could you give me a practical example of how that might look so we can get our heads around it a little?
Sure. Okay, a practical example. I haven't got one prepared, so I'm going to have to pull one out of my head. Okay, so it's common. Say if you're running training, right? This is a low-level one. You run training, and you think, well, we want to train people, build their capacity in order that they do something better. What might that thing be? I'm trying to think of an example that will be relevant for you. Improve training. Let's take a silly example. Like, you might want to teach people how to grow organic veggies. Okay, so you run a workshop and to show people how to grow the veggies. So you might count how many people went to that workshop. You might even count how many people were happy with the workshop. But that's not really telling you whether it's achieved anything. That's too low. Okay. But then you might go, okay, let's go all the way to the top. Let's see how many people are eating organic vegetables in our community. Working with a few people, and maybe there's lots of other influences, the cost, how many people got land. So if you pitch it right at that level, you may be too high. So instead you can go, okay, let's find out of the people who we're training, how many of those people have used what they learned from the training. So what proportion of people have used what they learned from the training? And that gives you an indication. And it has to be done after. It can't be done on the day. You have to wait 3 months. You have to follow up, and you find out what proportion of people are actually using their skills in their garden. Now that's telling you whether your workshop was effective, and it's telling you whether you're contributing to that broader thing. That is an intermediate outcome, depending on your level of influence. But in my example, it is. Does that help you think it through? Yeah. Higher than busy, really lower than absolute, somewhere in the middle. So you might want to have some measures at the really high level. I know it's what people care about, having report cards and talking about level of health and poverty are really important to know to help you pitch your work, but they may not tell you about your performance on their own. They need to be accompanied by things that help you predict whether you're on track. And that's where I was going to talk about lead indicators, but I'm going to not go into that in the interest of time.
Thanks, Jess, and I appreciate that very much. We're going to jump onto the Facebook page in just a few moments, and people can continue to ask questions of you there. Maybe we just need to bring you back for another webinar to talk about lead indicators. Please, for those of you who are watching, there's a question in your evaluation form that asks you to tell us sort of how you're doing now, what's your burning issues now that you've watched the webinar, what are the questions that are coming up for you now. That really helps us for you to tell us so that we can plan future events around your needs. Jess, I'm going to ask you one final question, if you don't mind. We started out today talking about those groups who are working with complexity. They've probably got more than one funder, they've probably got more than one program, and they're going to need to get ready now for evidence-based contracting with government. And many of those groups have sort of got a year for Oranga Tamariki, as I understand it. What's your advice, Jess? If we're at the beginning of this journey, where would you send groups first? And what would be your advice for their approach to mapping in those complex multi-agency programs in an outcomes framework?
Thank you, Jan. Yeah, it's challenging when you have lots of different funders. I mean, I generally believe that an outcomes framework is not for a funding source, it's for an organisation. That's where I always pitch them. That's what we mean by organisational frameworks. We mean something for that organisation, regardless of the funding sources. So you don't develop a separate outcomes framework for each funder. Ideally, you develop one for you, for your organisation, and it might be only parts of it, reflect the different funding streams. So one unified outcome framework for you as an organisation to think through what you're trying to do, who you are, and to get clear on your strategy. So that's the way I do it. I reckon it's worth fighting for to get that, because otherwise, what are you? You're just moving in the wind. So it's really important to be clear about who you as an organisation are and what your outcomes are, and maybe they're not all funded. Maybe some of them, are done through other streams. So I guess that one. In complexity, well, the complexity of it is deciding what's included in the framework and what's not, and you have to bring it up a level. You can't have an outcomes framework with 2,000 boxes in it, yeah? You're going to have to narrow it back, lump it up. But my one tip I would give you is, if you're struggling to make it simple, build a more complex one first and then simplify it. It's easier to go that way. I don't find it too hard to take a big one and go, just walk around the block and say, what are the 5 most important things? And simplify. Simplify. How do you simplify?
It's very rewarding, Jess. Thanks. I'm sitting here and I'm seeing that Crystal is smiling and nodding like crazy and taking prolific notes, which is definitely your best student. In our closing moments, I'll just hand back to Crystal and see if she has any final words or any. She's happy to catch by Taylor. Just thank you for your words. We're going to jump onto Facebook now. I will encourage people to have a look at Jess's Clear Horizons training page, and we're going to send the link out with the email that will follow shortly once we've done an edited version of today's event. Jess, it's been a tremendous pleasure working with you. And I first met you some years ago, and I remember thinking, gosh, I'd really like to work with this woman, because your tremendous knowledge of community, your Yorkshire directness, your practical understanding of what groups in our sector need for their work, and the great heart that you have for community and for people. We really, it certainly puts blood in my veins, Jess. So it's been great to hear you speak today. I'd love to invite you again. We'd love to have you back for a future webinar. And for now, we're going to jump onto the Facebook page, and David's just going to quickly bring up a slide to remind people of our next webinar, which you can, booking is open now for the next event on client level data, and we're going to show you a 3-minute video to show you how to use the What Works website. Jess Lass is going to give you a quick phone call, and everyone else will see you on the peer discussion group on Facebook now. So, tēnā rā koutou, kia ora everybody, and thank you for joining us.
Welcome to What Works. This website can help you figure out what difference you and your organisation are making. Take Tui, for example. Tui is currently under some pressure, swirling in questions, challenging his organisation's very existence. Are we making a difference for the people we serve? Could we be more effective? How can we show real results? Tui's organisation runs a program designed to help unemployed young people develop work skills. Now Tui's being asked to prove that what they're doing is helping, but he doesn't really know how to go about it. What Works has a series of tools designed to make this easier. You're one step ahead of Tui, given you've been introduced to us already. Our homepage contains some useful information to help you begin. The Consider tab is a good place to get some basic information about what evaluation is and how to do it properly. When it comes to proving that what you're doing is having impact, you need to walk through some basic steps. The Get Started tab contains a number of resources to help you formulate a good evaluation plan, from defining what you need to evaluate to making sure the findings get used. Now that Tui has identified what he needs to know, he can move on to choosing some data gathering and evaluation tools. The Tools tab is divided into 2 sections. The first is designed to help you choose the right framework or approach. The Methods, Tools, Techniques section contains the different ways of collecting data. TUI's stuck for where to go next and needs help to choose the right tool. To help with that, we have a handy Tools and Approaches matrix, which contains an overview of popular tools and approaches that can be filtered in various ways. TUI thinks he's found a good framework and toolset that matches his organisation's evaluation plan, but we'll have a bit of a look through the various case studies under the Stories tab first. It contains a selection of user stories about organisations' experiences using particular tools, so you can see what has worked for them. We're always looking for new stories. If you have an example to share, please contact Community Research. TUI can see organisations similar to his using the approach he picked, so he can see how it's going to work for him. With a good plan and tool set in place, TUI is well on the way to answering those original questions. Most importantly, TUI's organisation will build good evidence about their outcomes and learn from the evidence gathered. What works best when organisations like TUI's share their experiences with the wider community so other groups can benefit from the information too. The Share tab contains guidance on becoming a learning organisation and ways to share what you learn with others. There are tips on how to present your findings to service users, your board, funders, and the general public. TUI is going to take some more time to explore the website fully. We encourage you to take some time to have a look through the resources and see if they can help you with your work.